And we're now just 2 days away from the showdown, the House vote on health care reform, and President Obama's signature issue is on the line. Take a listen to the president at a rally earlier this afternoon touting the benefits of the plan.
This is a patient's Bill of Rights on steroids. Starting this year, thousands of uninsured Americans with pre-existing conditions will be able to purchase health insurance, some for the very first time. Starting this year, insurance companies will be banned from dropping your coverage when you get sick.
Congresswoman Cathy McMorris Rodgers is a Republican from Washington and joins us now. She plans to vote no, like other Republicans on Capitol Hill. Congresswoman, you're a member of the Republican leadership. What are you hearing? Does Nancy Pelosi have the votes?
That is the question that everyone is asking. Everywhere I go, people are asking, does she have the votes? And it's not clear yet. There's still a lot of meetings taking place. We continue to hear about members being called down to the White House to meet with the president. We watch members of leadership on the House Democrat side talking with members, chasing them down in their offices. So it's still unknown.
Let me ask you, was it a real setback for the Republicans, that CBO's scoring of the bill, that in fact the bill would save money, that it would cost $940 billion over the next 10 years, but it would reduce the federal deficit by $138 billion over the next 10 years and reduce the federal deficit $1.2 trillion over the next 20 years? Was that a setback for you?
I think it's important to recognize that this bill is going to increase spending by nearly $1 trillion. When Medicare was passed in 1965, it was a much different projection in Medicare costs than we have seen today. It's nearly 7 times what was actually projected. So there's a lot of questions about what the Congressional Budget Office has actually said. And the Congressional Budget Office fails to include the doc fix, which is a big issue for doctors all across this country, reimbursements for Medicare that could cost $200. Yes.
Congresswoman, the bottom line is the bill is paid for. Not only is it deficit neutral, it saves the American taxpayer money. I mean, $138 billion over the next 10 years. We're talking about $1.2 trillion. Isn't that a good thing? Doesn't that suggest that the reform would be the right thing to do?
It is paid for by cutting Medicare, nearly $500 billion. It is paid for, supposedly, by raising taxes, raising costs on our small businesses, on individuals, and it doesn't address what is a big question as to how we're going to pay our doctors in Medicare. We are not reimbursing them adequately. Everyone is in favor of the doctor fix, but that costs an additional $250 billion, and that's not included.
Well, I know that Republicans are against this bill for a number of reasons, and I think that many Republicans believe, politically speaking, that they can run against this in November, that they're going to be able to defeat a number of Democrats in the House by running against this. But I wonder how the Republicans message that when you say that if you vote against this bill, that you denied essentially a bill that would prevent insurance companies from denying children, for instance, who have pre-existing conditions, health care.
That is an issue, honestly, that Republicans and Democrats agree needs to be addressed. And when you look at the Republican proposal for health care reform, it includes addressing pre-existing conditions, raising the cap, that lifetime cap that insurance companies have placed on some plans. I actually had written a letter with Patrick Kennedy, Representative Patrick Kennedy, to the Speaker, asking for that cap to be raised, and that was included. There are areas of agreement. The Republicans believe that there needs to be health care reform. We just believe that there is a better way than this current proposal that we are concerned is truly a government takeover of our health care system.
All right, Congresswoman Cathy McMorris Rodgers. Congresswoman, good to see you. Thanks so much for joining us.
Thank you.
And the Justice Department